Hi, this is Nada with another interesting and conceptual video about cardiovascular system. This video will enhance your understanding about anatomy of human heart, blood flow through different chambers of the heart, and how it pumps blood to the lungs and body organs and systems. We'll also explain the mechanism and the concept of heart sounds. This is the human heart, which is present in the chest cavity, enclosed by the rib cage, between the lungs and slightly towards the left side of your body. The upper two chambers are right atrium and the left atrium, which are smaller as compared to the lower chambers, right ventricle and the left ventricle. The right side of the heart contains deoxygenated blood, while the left side contains oxygenated blood. The right side and the left side of the heart is separated by a muscular sheet called septum, which prevents the mixing of oxygenated and deoxygenated blood. We'll explain you the blood flow in the heart or about the heart cycle. So we'll start from the right atrium and we'll finish the cycle here. The right atrium receives deoxygenated blood from the body. Superior and inferior vena cava bring deoxygenated blood from the whole body organs to the right atrium. Right atrium contracts. When it contracts, there is a valve present between right atrium and right ventricle called the tricuspid valve. When this valve is open, blood can only flow from right atrium to the right ventricle. Then right ventricle contracts, tricuspid valve gets closed. Blood moves to the pulmonary artery. The only artery carries deoxygenated blood to the lungs, where blood gets oxygenated from the oxygen in the lungs. The oxygenated blood via the pulmonary vein, the only vein contains oxygenated blood, comes to the left atrium. When left atrium contracts, there is a valve present between left atrium and left ventricle called bicuspid or mitral valve. It is open, so blood flow from left atrium to left ventricle. Left ventricle contracts, mitral valve is closed now. Blood ejects out from the heart to the largest artery of the body called aorta. Aorta divides into further arteries, supplying oxygenated blood to the whole body organs and systems. This is how the body organs receive oxygenated blood. Once the oxygen diffuses from the blood to the tissues of the organs through capillaries network, blood becomes deoxygenated again, and all the veins from different organs carrying deoxygenated blood combine to make a large vena cava which opens into right atrium, and the same cycle repeats again. Now we'll talk about the heart sounds. Did you guys hear that? Yes, it's lub dub exactly. And this sound is because of the closure of heart valves. So we'll explain you here the details of heart valves, when and how do they work. As you can clearly see, there are 4 valves present in the heart. Valves are same like a device for controlling the flow of blood in only one direction. There is a tricuspid valve between right atrium and right ventricle. Tricuspid means 3 flaps. Bicuspid or mitral valve is present between left atrium and left ventricle. There is another third valve, a pulmonary valve at the origin of pulmonary artery arising from right ventricle, And there is fourth valve, the aortic valve, at the base of aorta originating from left ventricle. Okay, so what happens in the heart cycle? Both atria, the right and the left atrium, contract simultaneously. Blood flows to the ventricles. Tricuspid and mitral valves are open. Ventricles fill with the blood. Then ventricles contract, both right and left ventricles at the same time. The tricuspid and mitral valves get closed, and that makes the first heart sound LUB. This closure prevents the backflow of blood in the atria, so blood only flows in one direction and ejects out from the ventricles into pulmonary artery and aorta respectively. This is called ventricular systole, means ventricular contraction. As the blood ejects out after a little pause, ventricles now relax, or ventricular diastole. At this time, the pulmonary and aortic valves get closed, makes the second heart sound, that is DUB, to prevent backflow of blood in the ventricles. In the same time, atria start to fill again with the blood. Right atrium with the deoxygenated blood from the body and left atrium with oxygenated blood from the lungs. After all of this, when you are clear about the heart cycle, how the valves are functioning for keeping the blood flow in unidirection, and now if you imagine about your heart beats, that how many times exactly your heart beats in 1 minute, so you can imagine that how many times blood flows in your body from heart to lungs, from lungs to back to the heart, then from heart to the body and body back to the heart again. So I guess this video really makes a great sense to you. So please show your love and support, subscribe my channel, like and comment, share with your fellows and friends if you can, and see you guys in another interesting and conceptual video. Till then, take care, stay safe, bye bye.